Hello viewers, welcome to my channel. Friday videos are usually about occupational English test, and as I had promised on the previous Friday, today's video will be about OET speaking. So the easiest way to prepare for OET speaking is to search OET speaking on Google. That's what we will do here. And as I had previously stated, one should practice speaking from the official website of OET. That is the most reliable preparation resource in my opinion. OET speaking lasts for approximately 20 minutes, and if you are taking OET speaking on computer, then you can schedule OET speaking on a separate day, and it will be a test that you can take via Zoom. When I had taken OET in November of 2023, my speaking test was 5 days after the other 3 parts, but you can schedule it as per your convenience. It lasts for 20 minutes and it consists of 2 role plays, each lasting for 5 minutes each. And they are profession specific. As you know, occupational English test is for healthcare occupations, but there are several healthcare occupations. So doctors will have the medicine role play, nurses will have nursing role play, dietitians will have dietitian role play, and so on. Now, the speaking subtest is marked according to 4 linguistic criteria and 5 clinical communication criteria. We will talk about the criteria here before we get into a sample test. So let's discuss the criteria on which occupational English test speaking is marked. So here we have the overview of the criteria for the speaking part of OET. Now we have an overview of what happens in OET speaking. There are 2 role plays with an interlocutor. It is very important to remember that the role play is happening with an interlocutor, not with the examiner. The interlocutor is not responsible for marking your performance. However, they are quite helpful. So you will play the role of the profession that you belong to. So a nurse will play the role of a nurse, a doctor will play the role of a doctor. You are given all the information you need on a role play card, and you have 3 minutes per role play to prepare. During these 3 minutes, you can ask questions to the interlocutor such as, do I already know you? How to pronounce a certain word? If you don't understand a certain phrase, you can always ask the meaning, and the interlocutors usually do cooperate. Here we have mentioned that the scoring is marked according to 4 linguistic and 5 clinical communication criteria. The linguistic criteria consists of intelligibility, fluency, appropriateness of language, and resources of grammar and expression. Intelligibility, to be very simple, it means your accent should not interfere with the ability of the listener to understand what you're saying. Fluency is you should speak at a normal speed and you should not pause inappropriately. You should not give the impression that you're searching for structure or searching for words. Appropriateness of language refers to using the right words with the right tone and stressing at the right points. If you're using a complex procedure or a complex structure, then you have to explain it in simple terms so that patients understand, and you have to avoid medical jargon at all costs. Resources of grammar and expression basically indicate whether you can use idiomatic speech, that is commonly used idioms. Are they included in your speech or not? In clinical communication criteria, you have to show that you can build a relationship with the patient by talking to them in a friendly and respectful manner. You have to understand the patient's perspective and you have to take it into account while you are communicating with them. The communication has to be in a structure, so you have to use signposting. Like if you start with giving recommendations for certain diseases regarding how to prevent them, then you can start the discussion by saying, let me tell you something which will help prevent the development of these complications. So that is signposting. Then you have information gathering, which requires you to ask open questions at first and then more specific questions. But the question should be very clear to the patient, and you should always avoid asking double questions. And the final part is information giving. You should always give information in bite-sized portions, not too much in one go. You should pause and check for understanding. Sometimes the interlocutor does not express on his own that they are unable to understand you, so it is very important to pause and check if they are able to understand what you are saying or not. So with that out of the way, let us discuss OET speaking with the help of a sample test. Now in the sample test, what happens is there is a role play card, a card for the candidate which you will have at all times, so you can always refer back to it. It is not something you need to memorize. And there will be a role play card for the interlocutor which will be corresponding to the tasks that you have. So read that carefully in the 3 minutes that you have to prepare for the role, and then communicate for 5 minutes, and usually you need to keep talking for the entire 5 minutes and you will be stopped at the end of it. And there is no harm if you are stopped mid-sentence, but it's very important that you should summarize the entire discussion before the 5 minutes period ends. So with that out of the way, let us go directly into OET speaking sample, and I hope you will like this video. So once you have the role play card in your hand, you get 3 minutes to prepare. In these 3 minutes, you can ask questions like, what do I call you?
I'm Sally.
So Sally is the name of the patient. You can see here that the setting is local medical clinic, so there is a possibility that you might already know the patient. So it's very important to confirm by asking the interlocutor, do I already know Sally?
No, sir.
So the interlocutor has said that I don't know the patient. So I know the name of the patient, but I have never met her before. This is how you start the process, by knowing exactly these important details. This will help you frame the discussion that you're about to have. Now look at the tasks. You will have the card in front of you, so you can go in that logical order. Now let's start the 5-minute timer and let's start tackling the tasks. Hello Sally.
Hello, doctor.
I understand that you had a mild heart attack 2 weeks back and your recovery was uncomplicated. You were discharged from the hospital 4 days back. Am I correct?
Yes.
Could you please tell me your reason for visiting us today?
I feel much weaker and very tired since the heart attack. I'm worried that any physical activity such as walking, gardening, or swimming might bring on another heart attack.
That's very understandable, Sally, and thank you for expressing your concerns. I must reassure you that fatigue following heart attack is expected, and it would take up to 4 to 6 weeks for return of full energy levels. I must remind you that gradual lifestyle changes are important for recovery following a heart attack, and I'm sure you have medication which will help with your recovery process. It is of importance that you pay attention to exercise, because exercise is important for strengthening your heart as well as for your overall health, especially from the point of view of lowering cholesterol levels. Do you need any further recommendations from me?
I would like to know how much physical activity is advisable.
That is a very good question, Sally. I would advise moderate physical activity. As your recovery was uncomplicated and 2 weeks have already elapsed since hospital admission, I would suggest that you can participate in moderate physical activity and also join a cardiac rehabilitation program. This program will help you increase your exercise tolerance under appropriate supervision. Do you mind telling me what kind of a job you do?
I'm an office worker. I sit at a desk all day and I don't get much exercise at work.
Thank you for sharing that, Sally. Because you're an office worker, you have a desk job, I would suggest that it would take you 4 to 6 weeks to return to work. It is very important that you are physically as well as emotionally ready before you join work. Please don't rush back into your job. It is very important to plan your return to work, and we can talk to your employer so that your employer provides the appropriate assistance or support. Do you have any concerns, Sally?
I'm worried about having another heart attack, so I'd like to know what I can do to reduce the risk of further attacks.
Those are legitimate concerns, Sally. Thank you for asking me that. Yes, you can pay attention to your diet. It is a good idea to include vegetables and whole grains in your diet, and you should adopt a physically active lifestyle. It is very understandable to have the concerns that you have expressed today, and I would suggest that those were extremely normal and appropriate questions that you asked. I hope I have been able to answer those questions appropriately.
Yes, sir. Your information has been very helpful. I'll try to gradually do more exercise and I'll look into the rehabilitation program.
Thank you for telling me that, Sally. So, just to summarize, I have told you about the importance of exercise, the modifications that you can make in your diet, and the importance of joining a cardiac rehabilitation program. Thank you for your time, Sally.
Thank you, doctor.